This week is National Infertility Awareness Week, and to provide us with some details about infertility and the stigma behind it, I have Dr. Strozier here again. I'm so glad she's back because she was my first interview.
Okay.
So, infertility, can you tell me what can cause infertility? I'm sure it's a wide range of things.
Right. So when we're thinking about infertility, infertility by its definition is inability to conceive, inability to get pregnant. If you are under the age of 35, that's 1 year of trying to conceive and being unsuccessful. If you're 35 and older, 6 months is kind of where we cut that off. Of course, as you get older, you want to be more aggressive with trying to conceive. So what are some causes of infertility? It can be anywhere from female issues, not ovulating every month. May that be related to hormonal imbalances like thyroid disorder or problems with diabetes that's uncontrolled, polycystic ovarian syndrome. There also could be blockage of fallopian tubes, either from previous scarring, from an infection or endometriosis. Everybody thinks, oh, infection, I didn't have any bad infection like sexually transmitted infections, but infections such as a ruptured appendix could also cause blockage of fallopian tubes. And some people go on not knowing those reasons. There can be male factors for infertility as well, such as there could be low sperm count. There also could be a blockage. There could be hormonal imbalances in men, such as thyroid disorders, that can also affect sperm count. So there are lots of varieties. And then there are 30% of infertility cases that there's no known reason. Everything checks out well with the woman, checks out well with the man. Sometimes couples are incompatible as well, as much as we would like to really say that.
Wow, I never knew that.
Yeah.
Couples could be
incompatible.
Yeah, incompatible. That's crazy. Just like perfumes don't match for everybody's body. Like,
that's right. Some people's chemistries don't work. They cannot have a baby. I've had people struggle with infertility for a number of years. It can be a huge distress to a marriage. And when everything works out, maybe they're not together, get pregnant with the next person very easily.
So if you are a couple dealing with infertility or something like that, what would you suggest? Surrogate or anything like that?
So I think the biggest thing is to figure out what are the causes, what's going on. Oftentimes, infertility can be a huge source of distress, and it can also cause a lot of anxiety, a lot of frustration, so much so that people don't even deal with it or are very aggressive with dealing with it. My biggest recommendation is to have both people checked. So initially, women are told, oh, it has to be you, you need to go get checked out. Well, that's fine. Yes, we'll check the woman out. As a gynecologist, we do a full workup, but they're also, the male has to do his step. And sometimes it's a little intimidating to tell a partner, you need to go to the lab and leave a sample for us to check your semen level. And so that's the initial workup, is usually a pelvic ultrasound, checking your hormones, checking all your labs to make sure there are no medical issues that can be contributing to this. And from there, if everything checks out fine, or even if there are some findings, we usually refer to a reproductive endocrinologist. So based on the findings, it determines what's going to be the plan. For people who are not ovulating, it can be as simple as giving you a medication to cause you to ovulate. But we can't give you a medicine to cause you to ovulate if you've got tubal issues, because it can increase the risk of an ectopic pregnancy. So you don't want a pregnancy that's forming in the wrong place that can cause rupture and bleeding. So really doing an appropriate investigation to find out what is the issue. Some things are easy, some things are hard fixes and can be expensive. I think also just understanding that you have a lot of options, but what if you get to the end of your rope and you don't have those options? What would you do if infertility treatments don't work? Would you consider adoption? Going that wide range of options can be very emotional for people, and I think what can be a source of stress is also families. Families, friends, people always ask, when are you going to have a baby? Y'all been married for this long, what's going on?
I know so many people who deal with that. So with that, how do you deal with that emotionally if people keep asking you and it's such a touchy subject, how do you deal with that? Would you just say, be honest and be like, it's none of your business, or?
I think it depends on the individual. So if you're a very open person, you can just figure out as a couple how you want to answer those questions. Maybe you just disclose it to close family members. But if it becomes a source of distress where you become emotional in certain social situations where you may feel socially awkward, you might start crying, you absolutely need to seek help. And also explore your feelings on and come up with some specific sound bites on how to either discuss it or to shut down the conversation.
Thank you so much, Dr. Stroger, for informing us, because a lot of this stuff I did not know, and I've had friends to deal with these topics and how to deal with them. So thank you for informing us on how to ask, how not to ask, and how to answer.
Absolutely.